Well, as I mentioned, there are some risk factors. There are some simple scores. There's something called the Epworth score, looking at sleepiness during the day. There's a stop-bang questionnaire that many anesthesiologists, anesthesia nurses use as a preoperative assessment for sleep apnea, because we know that anesthesia can make sleep apnea worse. So I think individuals, physicians, and certainly electronic medical records should incorporate some simple screening questions that can be asked to an individual. If an individual already has some risk factors, such as an increased weight or obesity, if they have a thick neck, and if they have a history of snoring or being tired, those are things that would prompt further investigation, maybe one of the more specific questionnaires to see if a sleep study is indicated. Many patients with chronic lung disease have stress for a lot of reasons. Sometimes they have not been able to maintain their livelihood. They're worried about bills. They're worried about the cost of the drugs that are being given to them to help them at least stay with symptom-free if they can. That can lead to disturbed sleep. Often patients who tell me that they're having trouble sleeping, it is a combination of stress related to finances, work, family discord, things of that nature. So at least talking about that and trying to manage the COPD the best we can with medications, pulmonary rehab, things of that nature can help. If they have the signs of sleep apnea, which many of them will, because if they've gained weight by being more sedentary, they may have sleep apnea as well as COPD. That has to be treated. I think it's important not to just rush to giving them a sleep aid or a sedative to help them deal with that. If there's true stress that requires counseling, that should be referred out, psychological counseling, if there is something to that degree. So I think it is more a matter of awareness that this is a condition, like a lot of medical conditions, can make individuals depressed, can make them feel stressed out because of what's happened to their lifestyle.